It is my absolute pleasure to next introduce Delisa and Monica. Delisa is the Manager of Data and Evaluation at LABBN, and Monica is our data analyst. You have no doubt seen both of them in some capacity as they support you on the database through evaluations, CQI reports, and all of that. Thank you so much, Delisa and Monica, for walking us through your presentation.
And thank you, Charlene. Greetings and good morning, everyone. So the theme of our presentation is adapting and thriving amidst change. And next slide. So as we are all aware, this has been a trying year, and much of the data that we're going to share today and focus on is from last fiscal year, 1920. And as we think of last fiscal year, most of us probably just remember the latter half, so January to June, because it's been really packed with change and adjustments and uncertainty. So here are some words that we've heard or words that have come to mind most frequently. Positive, uncomfortable, verbal consent, virtual visits, Zoom, the new normal, and so many others. There's a couple that really stand out. So flexibility, that is something that we've all had to do, is to be flexible, whether that's working from home, engaging with families, engaging with our own families, and so much more. Creativity is another one that comes to mind, and we had definitely taken note that all of you have had to be creative and innovative to try to meet the clients where they are and adjust to the pandemic. So many of the successes that we are going to highlight in the next few slides really points to your creativity and innovation. And though most of these slides and successes that we highlight are really focused around what you've done during the pandemic, we know that the network that you've always been creative and innovative. So we are looking forward to highlighting you. Next slide. So there's been quite a bit of media coverage, and here on the screen you see a few articles that we've highlighted and the headlines around them. So the first one, MCHA, they were featured in the Hello Human Kindness podcast. One of the nurses was discussing how they helped a mom heal during a tragic loss. And then we have a California health report. And in this report, parents share their positive experiences with working with Shields for Families. Also in this report, they do a really excellent job highlighting what home visiting is and the benefits of it. And then the Sundial, El Nido Family Centers, they are featured and they discuss how what they're doing to meet the needs of clients during the pandemic. Okay, next slide. And here we have several agencies that were featured in the Chronicles of Social Change. These agencies, and they talk about how they were creative in meeting the clients where they are and providing needed resources to adjust to virtual visits. They also discuss successes and challenges to conducting virtual visits. Children's Institute, Inc., they were able to raise funds to be able to support many families with their rent and utilities, and they also were able to secure 700 tablets to distribute to families and to use for virtual visits. So congratulations to you all. Next slide. So our lovely communications team at LABBN, they were able to assist Miller Children's Hospital and Emanate Health with creating web pages through this pandemic. So this is another way for clients to be able to reach out, and interested clients to learn about the program. And they've also included like online forms in which the potential clients can provide their contact information and be connected with a Welcome Baby representative. Next slide. We also have a few sites who've utilized YouTube. So social media has been a great platform. Providence Little Company of Mary, their outreach specialists, they presented the Welcome Baby program at one of their Best Start meetings. and they uploaded that video to YouTube so that it can be accessed for other potential clients and they can learn about the program. Antelope Valley Partners for Health, they got creative and they have a video on demonstrating how to massage a baby, and they also have a story time video. So this is a perfect way to keep clients engaged and connect to clients virtually. And Northridge Welcome Baby, they partnered with their hospital and created a virtual maternity tour. And in this video, one of the outreach specialists shares the benefits and services of Welcome Baby. Next slide. All right, and there have been other virtual successes. All of our sites are doing virtual visits, so that includes phone calls and video chat as well. And there is great value in conducting visits using video chat. Home visitors and clients are able to engage a lot better through that platform. Observations of parent-child interactions take place, and a host of other benefits. And so we wanted to acknowledge a few sites that have really been taking the lead on this, and over 75% of their visits were done using some type of video chat platform. And those sites are Children's Institute, Inc., El Nido Family Centers, Maternal Child Health Access, Pacific Asian Counseling Services, Providence Holy Cross, Providence Little Company of Mary, The Whole Child, and Wellnest. And you will see, Monica's going to share some data a little bit later, but a lot of the agencies have really been stepping up and increasing their video chat. So the numbers just continue to go up. So congratulations to you all for those efforts. Next slide. All right, let's get into the numbers. Let's talk numbers. So prenatal enrollments. So we do see a decline in prenatal enrollments for last fiscal year, and we do think that is a result of the pandemic. Outreach specialists are not able to go out and connect with pregnant mothers, go to those events. And this is why we've seen the innovation in using social media, web pages, et cetera. But that takes a while to get going. So we look forward to seeing what the data looks like once those platforms really take way. But nonetheless, with the onset of home visiting, doing prenatal enrollments, we see that even though there's a decline, it's not as bad as it could be. As a network, it's still, last year was pretty comparable to the previous year. So we anticipate that that will go up as you all continue to get innovative and creative in reaching out to clients. There are a few sites that are excelling with prenatal enrollments. For Welcome Baby, we looked at prenatal enrollment rates, and Northridge and Providence Holy Cross are leading in prenatal enrollment rates, so congratulations to you all. And for home visiting, we looked at prenatal enrollment counts, and Antelope Valley Partners for Health and Wellness are doing a great job enrolling clients prenatally. Okay, next slide. Okay, so now let's talk about postpartum enrollment, starting with the hospital. When I see this slide, it just screams thriving to me. We can see that there's been a steady increase in hospital enrollments, and that's with hospital census being lower in fiscal year 1920. That's with the pandemic and everything. So this is really, like I said, it really screams thriving. There's been some CQI projects in which HLs, all the hospital liaisons, navigators out there who were open to trying different things. It's paying off. The numbers look great. And we've also heard that during the pandemic, there's been mothers who were more receptive to having virtual visits. They may not have enrolled if it was a home visit. So there's a few factors that go into play here. And with that, there are a few sites who have a great high enrollment rate at the hospital. Those sites are Providence Little Company of Mary, Emanate Health, and Providence Holy Cross. Next slide. Okay, home visiting postpartum enrollment. So this is very clear here that there's been a significant increase in enrollments from fiscal year 18-19 to last fiscal year. And we know that this is due to the DPH expansion. We also see the bottom lighter blue bar that Welcome Baby also were able to refer more moms to home visiting, and eventually those turned into enrollments. As well, all of the home visiting agency, your outreach efforts to enroll clients, that's clear too, that darker blue bar looking at external enrollments. So that has been successful. And as well, the DPH central office, all of your work and effort to send referrals to the home visiting agencies, and they turned into enrollments. So this is it speaks to the network, all of the collaborative effort. And there are a few sites who have been doing extremely well in enrolling postpartum. That's Shields for Families, The Whole Child, and Families in Good Health. So kudos to you all. Next slide. So now I'm going to turn it over to Monica.
Thanks, Delisa. Okay, so I'm going to walk you through the client's journey from giving birth at a Welcome Baby hospital and enrolling in Welcome Baby, receiving a risk assessment screening, and then being referred to a postpartum program. And this is the client pathway for fiscal year 1920. So we start off with hospital census numbers of moms who gave birth at our partner Welcome Baby hospitals across LA County. And this number was just over 32,000. And then of these moms who were available to be approached at the hospital, 81% of them were actually then approached by Welcome Baby staff, the hospital liaison. And this percentage is a 10% increase from what we presented at last year's summit. And we want to recognize so many of the Welcome Baby programs that have made improving this rate a major project. So next, the hospital liaisons will introduce Welcome Baby, see if mom is interested in the benefits of the program. If mom is interested, she'll enroll. So of moms who were approached, 62% then enrolled. And this is also an increase from past fiscal years, so great job. So then during the hospital visit, the hospital liaison will get to know mom and her family's needs. And these are needs such as housing, safety, mental health, food, breastfeeding, overall social support. And then based on these needs and program capacity and where mom lives, she will then be referred to a program that best fits her and her family. So of those who enroll at the hospital, 91% of moms were then referred to a postpartum program. And the majority of these moms were referred to Welcome Baby, 93%, and then 7% were referred to a more intensive home visitation program, HFA or PAT. Next slide. Okay, so now we're going to talk about the expansion of services for HV. So here we have a map of LA County home visitation enrollments in fiscal year 17-18. So in the indigo, we have zip codes that are covered by HFA, PAT, and Welcome Baby. And then in the pink, these are the zip codes that were covered by Welcome Baby only. So this is fiscal year 17-18. This is what coverage looks like. And so moms who lived in a Best Start community and had greater needs, they were able to enroll in the more intensive home visitation services, that's HFA and PAT. But if you remember from last year's summit, nearly half of moms who were screened at the hospital had greater needs but did not live in a Best Start community. And they were still able to receive the lighter touch Welcome Baby programming, but with the expansion, the aim was to increase services so that the greater needs clients could be served by HFA and PAT as long as they lived in LA County. So with the expansion beginning towards the end of fiscal year 18-19 and new teams covering every service planning area in the county, we are now going to fast forward to fiscal year 19-20, and we're going to see how the coverage for HFA and PAT expanded. So watch the indigo, next slide. So clearly, like you see the indigo, coverage by HFA and PAT increased substantially in fiscal year 19-20. And I have to say, if we were in person, this is when everybody would be applauding. It's weird to not see everyone. So just give yourself your own personal round of applause, pat on the back for this one. As Delisa mentioned, these enrollments into DPH, DMH, DPSF funded programs came from Welcome Baby Hospital, Welcome Baby Postpartum, and the community outreach efforts. It was really a network-wide effort. And because of this, so many more families have had the opportunity to receive the intensive home visiting services. Next slide. So on a similar note, we also see increases in the number of visits completed across all programs. So fiscal year 1920 saw the greatest number of completed visits ever. Every quarter this past fiscal year saw a high visit count. We can attribute this to, for Welcome Baby, kind of a steady increase in hospital enrollments. And then for HV, obviously, the DPH expansion was a huge factor, more capacity, more home visitors, more reach across the county. Next slide. Okay, so now we're going to focus in on the total visits in April through June this past fiscal year, so during the pandemic. So this is touching on what Delisa had mentioned a little bit earlier. The definition of a home visit is looking a little bit different since mid-March. So in the teal, these are phone call visits. And then focusing in on the dark pink, these are the virtual visits that were done through video conferencing month to month. So in early April, our network was still sorting out procedures for data entry. Agencies were figuring out technology and protocols, but you will see that dark pink section is steadily increasing each month in Q4. It has not been easy, and we just want to recognize the efforts at every agency to increase the proportion of visits that are completed via video. And I really wish that we could show July counts, but we're not all the way through July. But I just checked this week, and video visits are making up about 60% of total visits for the month of July thus far. So great work. Next slide. So to paint a better picture of the moms that we serve, I also want to just share some demographic information. So looking at age of mom at the time of enrollment, about half of moms enrolled are 25 to 34 years old, and then a little bit less than a quarter of moms are either 20 to 24 years old or 35 and up. Next slide. About 3/4 of the moms that we serve are Latinx, 9% are African American, 7% are Caucasian, and 5% are Asian. And other race ethnicity categories represent less than 3% of the client population. Now I'm going to pass it back to Delisa, who will talk about program impact.
Great, thank you, Monica. So as a network, there have been over 13,000 referrals that clients accessed in fiscal year 1920. So this really speaks to meeting the needs of the clients. So all of these referrals are based on client needs. So either the home visitor or the client themselves identified a need and a referral was made. And these are the referrals that the clients, they actually accessed the resources or they accessed the services for. And I would say one of the contributing factors to this is that home visitors, you are constantly following up and checking in with the client around whether they access the referral, they need help setting up appointments, reaching out. So all of those efforts speak to these numbers here. And the top 5 referrals are charitable services. So that's like diapers, clothing, lactation support, parenting groups, food needs, and health insurance. The referral category that's increased the most is probably food needs from last year, and we do think that is due to the pandemic. Okay, next slide. Okay, so now looking at screening, depression screening. We see that our network, I mean, look at this, Welcome Baby and Home Visiting, 99%, 96% of clients are receiving a depression screening. And this is important because early screening means treatment can be initiated before the disease is worsened. And depression after birth can affect breastfeeding practices and the ability to bond with the infant. It also increases the long-term risk of cognitive and developmental problems for children. And so by screening early, our network doing its part of screening, it really helps mitigate the negative effects of depression. And next slide. Another preventative measure is developmental screening. So as you can see, compared to California and the national average, our network is doing an excellent job with screening for developmental delays. Our network uses the Ages and Stages questionnaire, which is a validated tool. And the value of screening as well, it leads to early intervention, and early intervention is effective in high-risk children and associated with improvements in cognitive and academic performance. So when there are delays that are identified, our programs connect them to the needed services. So they'll refer them to the regional center so they get the services that they need. And our network really contributes to the healthcare field in this, because a lot of times physicians will state they don't have time to do these types of screenings. So our network, we can step in and do that part and ensure that families are connected to the services they need and can get these developmental delays addressed. So kudos to our network. Next slide. And then we have the 6-week postpartum visit. So this is a HEDIS measure, and HEDIS is a tool that's used by 90% of America's health plans to measure performance on important dimensions of care and service. And during this visit, the doctor, they're checking to make sure that mom is healing, how she's feeling emotionally. They'll check to make sure that her reproductive organs are getting back to the pre-pregnancy state. So they're really checking for those immediate health risks. So it's a very critical visit. And you can see that our agencies, we do an excellent job with making sure that moms get that visit. And what's a contributing factor there is home visitors are following up with mom, asking, did you attend the visit, educating them on the importance of this visit. So I believe this is why the numbers are very high here. We also have a few sites that are doing extremely well on this measure. That's Friends of the Family, Miller Children's Hospital, and Providence Little Company of Mary. And I would say there are a lot of sites that are doing well on this measure. So continue that great work. Next slide. Okay, now I'm going to turn it back over to Monica, who's going to close us out.
Thanks, Delisa. Okay, so we're going to look at this year's graduations from home visitation programs. So for Welcome Baby to start, we see a continued increase in program completion counts for fiscal year 1920 compared to past fiscal years. And these increases are both for Welcome Baby Full, the 9-month program, and for Welcome Baby Light, the 2-month program. And we want to highlight the agencies with the best program completion rate. So that would be St. Mary, Emanate Health, and Valley Presbyterian. Great job. Next slide. So now we look at HSA and PAT graduation a little bit differently. As we all know, it's a long-term program, 3 to 5 years. But with that said, we continue to see increases each year. So there were 118 graduations from HSA and PAT in fiscal year 1920. And then I really want to focus in on this other number up here on the slide. Nearly 500 clients have been in the program for 2+ years. And that's just so impressive to continue that engagement. It just speaks to how special the bond is between home visitor and the family. Next slide. And then lastly, I want to highlight some of the results from the Welcome Baby client survey from fiscal year 1920. So the first one, out of 5, when asked to rank the statement, "My home visitor helps me build confidence as a parent," clients rated an average of 4.8 out of 5. And then the second one was a new question. It was only asked in Q4 around the pandemic. It's out of 5 again. So when asked to rank the statement, virtual home visiting met all of my needs and expectations, clients rated an average of 4.8 out of 5. And I think this second survey item really highlights more than ever how excellent our network has been with collaborating and adapting to the quickly changing environment. And not only are we adapting, we are thriving. And the proof is in the numbers, the proof is in the stories, and we just want to congratulate everyone on a fantastic year. And that concludes our presentation. Thank you so much.
Thank you so much, Delisa and Monica, for your presentation. This was a fantastic way of summarizing what the impact of our network is on the families and the communities that we serve. I want to take a moment and switch over to Jana and Kayla and see if there are any questions for Delisa and Monica in the chat box or the Q&A box. Just give it a moment for that.
Hey, Shirley, there's no questions in the chat box.
Thank you, Kayla. All right. Well, that's a good way to segue into our next Mentimeter question. But before we go on, Delisa and Monica, thank you so much again for this presentation. I know there was a lot of time and effort that went into bringing together the various models, the sites, and so on and so forth. So thank you to you both for this presentation. So with that, I'm going to go over to a Mentimeter question. I'm going to go ahead and share my screen again. And I see responses are already coming in, but the question is, what stuck out to you regarding Delisa and Monica's data presentation? So all the awesome statistics, the improvements, amazing job HLs are doing. The data surrounding the families H3P provides impact and how the need is present. Still getting responses in. Effective and successful teamwork. Getting a lot of responses in, so thank you for those improvements. All right, thank you so much, everyone. I'll give it another 10 seconds to get a few more responses in. All right, I'm going to go ahead and stop my screen.